All right, welcome. So I know that we have I'm seeing a lot of familiar faces, but some names that sound a bit like they're new to the group. So I'm going to just introduce this ECHO session and share a little bit about Project ECHO and Wayside Recovery Center, give you some background on that. But thank you everyone for joining today. So at Wayside Recovery Center, we are located in Minnesota, and we provide mental health and addiction treatment services for women, children, and families. Project ECHO, the ECHO part stands for Extension for Community Healthcare Outcomes, is the second portion of this, and it's a movement to really demonopolize knowledge and amplify the capacity to provide best practice care. So together we have the Wayside Women's Wellness ECHO. It's 1 hour long at noon each month. I know 1 hour sometimes doesn't sound like much time, but it's really meant to be sort of a lunch and learn style series with the goal of sharing practice and support information, which will hopefully enable participating organizations to empower all people in recovery and empower women and families to break the cycle of addiction and trauma. So I mentioned this as some folks were joining, but I would also like to just share a little bit. In addition to the Wayside Women's Wellness ECHO, we also have another series that we offer, which is a maternal and infant health series. It's also ECHO sessions monthly. And this series is going to be having a free virtual conference on January 17th and 18th. And it's going to be focusing on the topic of SUD and OUD. And maternal and infant health. So very interesting. We already have some great speakers lined up for that. So I will put in the chat links to register for that conference, but I just wanted to mention that as well. My name is Zora Darcourt. I'm the Director of Training at Wayside Recovery Center. And today our ECHO session is entitled The Importance of Leadership Support for Employees Impacted by Substance Use. So this is part 2 of our current recovery-friendly workplace series. We had part 1 about, I think it was 2 weeks ago now. And that one was about how to establish a workplace that supports an employee's recovery. So it is helpful if you have attended that past one, but you don't have to, it's not a requirement. Thank you for joining if you're here. Don't go away, stick with us. And so I'm just gonna share a little bit about Dr. John Narain, and then I'll pass things over. So Dr. John Narain is a person in recovery and the founder of Recovery Friendly Leader, which is a nonprofit organization whose mission is to empower leaders with solution-based strategies to support employees impacted by addiction and promote safer, healthier, and more productive workplaces. As an active member of his recovery program, John has also become a certified employee assistant professional and received his doctorate in business administration by completing a qualitative research study on leadership strategies to prevent substance abuse relapse and optimize business viability. Dr. Narain is also the author of Leading Workplace Addiction, and John's other commitments include serving as a consultant for Colorado's Recovery Friendly Workplace Initiative, also a board member of the Rocky Mountain Chapter Employee Assistance Professional Association, and sitting at the table for several recovery-based coalitions, both locally and nationally. So lots of experience, lots of knowledge, and we're really grateful to have you here, Dr. John Narain. So I will pass things over to you.
Thank you so much, Zora, and thank you everyone for having me again. I want to start off by saying I apologize once more. Last time I was here, I had a cold. Today, it is still there. The congestion is still there, so I have some tea that I might be sipping on throughout the presentation, and thank you for bearing with me. Thank you so much again, Zora, for that recap. And I do want to recap again of what we talked about last time. So it was about how to set up the workplace, right? The policies, the culture, the resources available that are supportive to employees in recovery, right? We briefly touched on what was the problem that we're seeing in workplace today. Well, nationally, 1 in 12 workers, this is anybody, frontline, CEO, manager, whether you work inside, outside, whatever it is, 1 in 12 of those workers battles the disease of addiction. So the COVID-19 pandemic just really brought this fact to light in more recent years. Um, Specifically in 2020, what we saw is the cost of substance use to US employers was 696 billion, and that's through lost production, absenteeism, healthcare, and other costs. So what the Recovery Friendly Workplace is an organization that uses evidence-based policies and practices to address that, right? It's to unite the entire organization by recognizing, even though substance use is a problem, we understand that when employees are in recovery, they're an asset to our business. They're more engaged. They're more likely to show up on time. They cost less in healthcare than our general workforce. All of these have been proven statistics. So the Recovery Friendly Workplace recognizes that strength and is willing to work intentionally with people in recovery. So the 5 steps that we talked about of how a business can support these employees can be considered a recovery friendly workplace is first, very simply, understanding what's our purpose here, who are we seeking to help, and what are the objectives that we have in this initiative. How do we adopt and practice some principles or core values that really unite us as one and promote well-being, health, safety, inclusiveness, right? How do we value those things through the values that we express and demonstrate in the workplace? And how can we add some other practices like policy, right? Policies that not only discuss consequence, right, for active drugs in the workplace, right, use of that, but what are the protections employees have for coming forward and asking for help, right, for actually wanting to live a healthier life if it's causing an unhealthiness in their life? What are the policies that protect it, and how can we educate employees on this and train our leaders on what this means, which is what we're going to dive into today. And what are some programs and services not only that we can offer within the workplace, but maybe be connected with in the community? And lastly, just like any other business venture, reviewing employee performance processes, overall evaluation, how do we just sustain the work that we're doing here? So that was in our last session. On today's agenda, what I want to talk about is now that the business is set up as a friendly workplace, right? Is set up to support these employees in recovery. It's important that we talk about how we can train leaders to demonstrate what exactly this means in the workplace. I think I've shared briefly on this last week, 2 weeks ago, but years ago, I was an operations manager at a law firm. Now, this law firm was technically a recovery-friendly workplace. What I mean by that is they had the culture that was people first, right? They really cared about the well-being of their employees. They had the principles. We had core values posted on our wall. This is what we collectively believe, what can really help connect us together as a company, right? Drive our mission forward. They had policies, things like flex time, mental health days. The funny thing about mental health days is we weren't required to give a reason. It was just automatically um, approved, right? If we needed one. Mental health breaks. It was encouraged that we would take breaks from work and go for a walk or go sit or do something so that we can come back to work and re-engage, right? And be able to focus more. They had resources accessible. They had everything set up. But the one thing they did not have was any training. So when I struggled in that company and I came forward and asked for help, no one knew what to do. It was really like flying blind, right? And unfortunately, this is something that's come up more and more. I've done many advising sessions in the state of Colorado, and employers are not really sure what they are to do in situations when someone comes forward and asks for help. So, what Recovery Friendly Leader is, as Zora was mentioning, we are a nonprofit program that will train the manager and supervisors how to support these employees. What we want to make sure is the leaders understand that now that they're working in a recovery friendly workplace, that they know how to tell if an employee is exhibiting signs that they're struggling, right? How to appropriately address that employee, know how to speak to them. Like, what can we say? What are things we shouldn't say, right? And what steps can we take to prevent small issues from becoming bigger problems in the workplace? And to do that, we primarily work with leaders that are already engaging in some type of a recovery friendly workplace, that they're in a position where they can support employees and just simply that they're willing to practice the things that they learned. The reason why it's very important that we work with someone who works or is employed in an organization that's considered somewhat recovery friendly is because I can't train a manager how to help an employee feel comfortable coming forward to ask for help if there's no policy to protect that employee, because we will just cause more harm that way. No employee will feel comfortable after that coming forward anymore. That's why it's really important that they don't have to be certified a recovery friendly workplace, but they have to have some type of protection for that employee if we're going to train. In those advising sessions I've done in Colorado, there were many different businesses in many industries: construction, healthcare, hospitality, all of which, as you can imagine, have their surrounding and unique issues about substance use in that specific workplace and what they can actually do, what that industry can actually do to help these employees. It's funny because there's still a warped perspective that if we actually openly state, right, to the company that we support employees in recovery, we're going to lose our federal funding, because we have to comply with the Drug-Free Workplace Act, or we can't condone people using drugs by having Narcan in our offices. This is the talk that's still happening. So the reason why that's warped is because that's not what this is, right? This is how we can get employees feeling comfortable talking about issues as they arise, right? Not holding it in. And how we can encourage employees who are making progress in recovery to continue, because that's what we want. We give managers and supervisors the tools on how to make these opportunities happen. So at Recovery Friendly Leader, we offer several strategies on how to do this. All, would take days to go over. So when I was putting this presentation together, I was thinking about what strategy we were going to talk about in an hour for this specific group. And I really thought it would be best to focus on what keeps coming up in the healthcare and mental health industry for us. And that's the inability to freely talk about recovery or substance use issues because of fear. Now, isn't that a paradox, right? In the mental health space, there is a fear of talking about mental health. So today we're going to dig deep into a subject I know many of you are probably familiar with, right? And if you have clients, you probably know how to do this with your clients. It's how to build that personal connection through having vulnerable conversations. I've done research on the basic needs of employees in the workplace, and the need to belong is one of those needs. Also, we know the opposite of addiction is what? Connection, right? So when we build a personal connection, we're meeting both of these needs. And we're potentially eliminating that feeling of I don't belong, or I'm unworthy of help, or any type of disconnection to a manager, to our coworkers, and to the workplace itself, right? Because that disconnection can be a motivator to fulfill um, that connection by coping through drugs or alcohol. So as we go through each component, as you see on the screen, there are 5. I want you to think about not only how these apply to employees or maybe clients that you may serve, but how this can apply within your own place of employment, right? With either yourself or as an employee, or maybe a team if you manage one. My goal for today is that we learn from each other how to bring down the barriers that unfortunately still exist and stigma that still exists in the health and mental health industry, and how we can truly allow employees in this field the same opportunity we're giving our clients, right? The same opportunity to recover and reach our fullest potential. It's funny. I have a sponsee, and we just got to his fear inventory actually on Tuesday, and I was laughing as we're doing it because I'm like, I think I need to redo one of mine because fear, unfortunately, still runs my life sometime, and it can definitely drive my actions if I allow it to. So how do we build this personal connection by allowing vulnerability? Well, first we want to reduce factors that can entice fear from doing this, because fear comes in many forms. And for employees in recovery, it could be the fear of being stigmatized, the fear of loss of employment that can really prevent someone from being honest, right? I mean, this has come up so much in many industries, especially industries where policies state and have a firm tone on the consequences that will result of substance use, right? Such as the loss of a license, um, the loss of or violations to our record, right? We see that a lot, not only in healthcare, but within the Department of Transportation as well. I was at a conference in July in a mountain town called Steamboat Springs here in Colorado. And in that conference, no, was it Steamboat? Yeah, it was Steamboat. And in that conference, it was peer recovery support professionals. That was who it was for. And I asked the audience, I asked them, would they feel comfortable telling their boss if they were struggling with substance use, if they had thoughts of using, if they were triggered? And majority of them shook their head no, and my jaw dropped. I could not believe it because they are people with lived experience and their managers are people with lived experience. Their job is to get people to talk about that, to talk about triggers, and they don't feel comfortable themselves. If speaking about recovery helps employees enter and maintain, right, a safe, healthy, and productive life, but there's this need to appear strong to show that we have it under control, and it can threaten my employment, right? Something that fulfills my basic need for survival and safety. Well, that's an unjust predicament. So in one hand, I can speak about recovery because it will help my recovery, potentially save my life. But if I do that, I might lose my job. Well, which need becomes more priority in that case? That's something I struggled with for years. I didn't know which need for survival, which need would give me life actually mattered first. And I had no one to really help me because I couldn't be honest about it. You know, if an employee needs to communicate with their leaders about something that's going to threaten their recovery, or maybe they're just having an off day, we need to remove barriers that generate fear from doing this. And on the contrary, even if employees are just doing well and they want to share that, they want to share the success, that should be allowed too. Since that conference, what we've done at Recovery Friendly Leader is we've implemented a professional and personal check-in with a recovery and wellness component. And we start our board meetings that way because we also need to be the example that it's okay to talk about these things. And it's funny because the same morning we implemented it, I had shared that even though I'm in recovery, right? Even though I'm a sponsor and I still have a sponsee and I work steps and I'm of service and I do all these things for work and I learn about harm reduction. Even though I do all these things, I still had thoughts of using that week. And I don't get why. And I shared that with the board because it's our mission, right? We're here to support employees. We need them to feel comfortable asking for support. So why shouldn't we be able to do the same? It would be a true shame if we couldn't. So what you see here on the screen are certain factors that could reduce fear and help employees feel safe about sharing their recovery with leaders, right? Let's set the example, just what I just mentioned. Just because I have a thought or feeling doesn't mean I act on it today, right? In fact, the way I've learned not to act on it is to release that thought and feeling by sharing it with someone. We don't teach people that the way to release that thought is to keep it a secret, right? To keep it in, because that may be the very fastest way to lose our license or certification. the thing that we're afraid of losing if we open our mouths. So having policies that are not punitive in nature and tone, that's truly important. Like I said, making sure that these policies are clear and well understood on what protections these employees have. Having an environment that's inclusive, non-discriminatory, having an open door or welcoming leadership style, right? If a leader says, you can talk to me at any time, all right? Is that really believable? You know? But if a leader maybe softens the tone and looks someone in the eye and say, listen, I know you may not believe me, but you can talk to me whenever you want, and I'm here whenever you're ready. It's just slight differences. Like, what is the leadership style? Are we being mindful of how we're communicating to these employees? Are we thinking about what can help them feel safe, that it's okay to talk? Some things we can do to minimize these fear. So I would like to open for a second to for a question for you guys. Like, what are some factors at your workplace, or if you have clients or clients, that could cause employees to be afraid to talk about their recovery? And Zora, I don't know if you're fine with people just unmuting themselves.
Yes, for sure. If you want to just unmute, you can. If you feel more comfortable chatting it in, I can watch the chat as well.
No one? I guess everyone is comfortable.
Kendall said stigma.
Great, Kendall. Talk to me about stigma. What exactly do you mean by that? Because stigma is correct. Stigma is still present. You know, the stigma that I've seen more and more in these advising sessions is when I hear the word recovery, I automatically think I'm hiring someone. Oh, she's trying to unmute. Okay, I will wait. Or just cut me off as soon as you unmute. But when I mention employees in recovery, the perception goes an employee actively engaging in problematic substance use. That's still the perception of some employers today when we hear the word recovery.
Sorry about that. I was having trouble unmuting. Just mainly having people look at them differently, treat them differently from there on out. Whether they're doing well, but especially if they are struggling or going through difficult times. It seems like that's when there's the most fear of it.
Right. You're exactly right. I mean, I know for me, I already felt like the black sheep and an outsider. So if I admit who I am, are you going to confirm and validate that feeling that I really
Right,
don't want to be true?
right.
Yeah, great point.
And
Thanks,
then
Ken.
also the fear of being reprimanded.
Mhm.
If they speak up and say they are struggling or having a difficult time, and then having more eyes on them, and if they do slip up and lapse, being reprimanded for it.
Right, right. Being punished for who I am, even though I'm
Yeah,
struggling.
yes, even when you ask for help.
Right.
Yeah.
Really good point. Thank you, Kendall.
We have a few comments that came through in the chat as well. So Wayne said culture that focuses on substances, especially alcohol and cannabis, is a part of the social network of the business, which I think you kind of talked about too last time, John, about just how sometimes organizations, that's a part of the culture and networking.
Hmm.
And then we also, oh, I don't know if you want to say anything about that.
Yeah, happy hour is still very strong. there's a happy hour culture in a lot of businesses too. So if I don't go out to drink, will that hurt my job in some way, right? That could be definitely be putting pressure on wanting to engage in substance use in that manner. Definitely.
And then we also have Michelle said there's an expectation that staff have more recovery or sobriety than the clients. I think there would be a fear that staff are struggling the same as the clients. That's interesting.
You know, I'm still shocked more and more every time I hear just a little more detail about um this industry. You know, and our industry I'm part of too. I'm a part of this realm. But you know, we all struggle to some point. Let's remove the word recovery out of it. Life just happens, right? I mean, how many times have I just not wanted to get up and go to work and had nothing to do with substance use, right? It's just about talking about it, talking about it. You know, I know people who are not considered to have a substance use disorder that want to go out and take a couple shots after a hard day at work. You know, the difference between them and me is I would just be willing to talk about that feeling or thought today as opposed to pulling another coworker and actually going to do it. Right? Great point, Michelle.
And I think we have two more comments. Carlos said, and sorry, my chat's a little off here. One of the objectives of recovery is to adapt again to rules and procedures that were violated or lost during the consumption stage. In a job, are there norms, rules, objectives to meet, or could they change or because this is a person in recovery? I'm a little confused. Carlos, are you able to unmute too? I think there was a question there. The world does not adapt to people in recovery, Carlos said.
Carlos, are you there? Oh, his mic is not working. Okay,
Sorry,
let me read.
mic not working.
Let me see if I can read this one more time. One of the objectives of recovery is to adapt again to rules and procedures that were violated or lost during consumption stage in a job. Are there norms, rules, or objectives to meet, or could they change or so? So I think you're talking about once someone decides that they're going to pursue recovery, whether that be abstinence, harm reduction, whatever it is, are there certain criteria that the job might have for them to re-engage with the work? Am I understanding that correctly?
I think so.
Okay, if that's what it is, there is something workplaces can adapt, similar to a performance improvement plan, PIP, right? If they wanted to re-engage work, there might be certain conditions that the employee may have to meet. I've seen um, return to work agreements that were aligned for a person in recovery. What that may look like, maybe if a person left for treatment and they were coming back to work, they may not work full time at first. Maybe let's start them part time and give them a lighter set of duties and see how they do. It's kind of a slow transition back to work, and all of which are personalized to what the employee needs and what the business needs, right? Because there's not really a cookie cutter for how to do this. We really have to take each situation and each case and consider it unique to that individual and work with where they're at. Great questions, by the way.
And we just had one last comment here. With policies that specifically state that using, including seeking treatment, will result in termination of employment. And the person said that that's what our policy states, that it will result in termination of employment.
I'm looking for that comment.
Oh, it was just a direct one to me, I think.
Oh, can you repeat it one more time, please?
Yeah. So it says, organizations that have policies that specifically state that using, including seeking treatment, will result in termination of employment.
Really? That's a new one for me. I'd love to, if you have a copy of that, or willing to talk to me more about that, I will put my contact info in the it'll be on at the end of this presentation. I'd love to hear a little more about that. All right, so in the essence of time, thank you all for your comments. I do have one more question before we move on. What are some things you think you can do to help employees not be afraid to talk about their recovery at your workplace? And maybe we'll just take one or two answers here before we move on. Anyone? Should I call on someone?
We have a comment here. I think the
Okay.
culture is to talk about their recovery, but not talk about struggles.
Thank you, Michelle. Yeah, you could, starting off, right, talking about the successes and what's working, right, could definitely start bringing down some of those barriers, right, to where people can start feeling comfortable and maybe safe. I think safe is really the word we're trying to achieve here, right? It's a great point.
Yeah, Michelle added, I've encouraged my staff to talk, oops, another chat came in, to talk about any barriers.
That's awesome. Thank you, Michelle, for doing that.
And it looks like Jake said there are mixed opinions in treatment centers as to whether staff, counselors in particular, should share their recovery with clients, and that this can translate to whether or not a counselor should come forward regarding this issue with their supervisor or other staff. Supervisors need to make it clear that it's appropriate to come forward without risking termination.
Right. Thank you for bringing that up, Janet. I've heard that too, that there is a mixed opinion, yes, on whether counselors should or should not share. That's a great point. Thank you very much. All wonderful comments. So minimizing fear. What do we do next? So if the workplace factors in how to minimize fear, we want to reassure employees that we're going to provide that safe environment where they can feel comfortable enough to express their truth. See that this goes beyond merely saying that an employee can be honest and vulnerable with us. This requires evidence that we mean what we're saying. And you guys just explained why, right? In those comments just now. Sometimes for an employee to believe that certain conversations and emotions are allowed to be expressed in the workplace, it might require the leader to take the lead by sharing honestly and vulnerably first. This really demonstrates the example of what employees can express at the workplace. And as it pertains to treatment centers and the healthcare industry, let me give you an example of what another type of healthcare setting is doing to help employees with these conversations. There is an organization called uh, uh, Healing Circles Global. And what they provide is a safe space where for nurses, and it's a peer support model, where they can share with each other vulnerably of anything that's going on with them. It could be about maybe the hours that they have to work, or their patients, their families, grief and loss, and also their mental health and recovery. In this circle, you're not asked to believe anything spiritual or religious, and there are two types of circles that these can be hosted in. One can be within the healthcare system, where it would make up the people that work for the company, right? And it would be in person. And the other is globally on a platform where it can consist of anyone in the world. But what really stood out to me about this model is two things. First, it's peer-led, right? So there is a facilitator that can start the meeting, and what they do is they share first, and they do that to model the vulnerability that can happen here and that it is okay. That really stood out to me. And the second thing is within their agreement to participate, confidentiality and anonymity is to be held. Kind of the idea what happens in the circle stays in the circle. But I wanted to learn a little more about nurses who were experiencing issues with substances and whether it just be a thought about using, or if the nurse had actually proceeded to use or had a reoccurrence of use. Because we all know within this field, there's a policy concerning mandatory reporting. So with that being the case, how can anonymity and confidentiality really be upheld? And is this truly a safe space where nurses can share without fear? So what I've come to learn is that there are protocols in place when someone shares in the circle and they do need some extra support. They're encouraged to stay on this meeting after and speak with the host to try to determine what type of support is needed or what type of resources can help. Now, their in-person model does have an agreement to uphold confidentiality. However, it is ultimately governed by the organization's policy. What that means is, yes, unfortunately, if it's an in-person circle, there has to be mandatory reporting. However, if a nurse were to share on the global platform, there's no governing policy, and they would be able to share vulnerably about their struggles without any fear of mandatory reporting. So there is an option. The point of what I'm trying to say is practicing sharing honestly and vulnerably, right, is so essential if we want to potentially gain the employees' trust that they can come to us when they're really in need of support. So I know at treatment centers, staff is truly focused on how they can best serve their clients, but my goal is that the staff may also benefit from understanding the best way to serve these clients is to make sure they themselves are taken care of as well. So now that we've gotten what I would consider the hardest part, and that's getting someone to talk, right? That is just the hardest part about what's going on. What do we do next? Listen. That's it. Don't speak. There's nothing to be said. Let's listen, actively listen, be engaged in what that employee is saying. Focus completely on what they're intentionally trying to communicate to us, right? And active listening can be challenging. It's a big challenge for me still, because I like to multitask. I like to think about what I'm going to say next. I like to plan out how I'm going to respond. I still do that sometimes, and it can be a challenge. However, if I refocus and think about how important this is right now, right, and I can try to be considerate of what the message the employee is attempting to convey here. So a few simple things we can do. One, maintain the focus, right? Stay completely engaged. Pay attention to what this employee is saying. Understand that it's important. Maintain that eye contact. Simple smile or nod as they're talking can communicate, yes, I heard you, I'm listening, and I don't need to interrupt you by saying that, right? Ask questions when the time is appropriate. Ask them either open-ended or specifically. We want to offer the opportunity for the employee to provide more information or clarify something we don't quite understand, right? And the last one, paraphrase. Let's summarize what I just heard. Give that employee the understand to confirm or re-clarify what the employee was trying to say. All very, very important. So we have fear minimized, right? They're starting to speak. We just listened, right? We confirmed, we heard what they said. Now what do we do? How do we respond after that? Empathy. Okay, it's the most crucial component to building a connection. It's extending some empathy, whether we agree or not, whether we believe or not, empathy, right? Showing understanding, emotion, and concern, right? How many of you, most of you are probably already familiar with Brene Brown. So I'm going to play the short video, which if you've seen it, I hope you like to see it again, but it really sums up empathy and how it fuels connection.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
I told you I'm a crier now in sobriety, and I don't know, just something about that response. I don't even know what to tell you right now. I'm just so glad you told me. I mean, that's all someone's looking for, right? Is to be seen and heard. That's it. An outcome that fuels connection, as Brene Brown said. While active listening gives us the chance to understand what employees may be going through, it's extending that empathy, which is the guiding force for how to respond and share that understanding. If employees are feeling bad, it's taking a second to slow down and recognize that. If our employees feeling hurt, it's taking a second to recognize that. Getting the employees seen and heard. The challenge with empathy, as she mentioned, is it requires the ability to connect with our own emotions, right? Reflect on the time where we may have felt similarly. And the beauty of having the ability to do this is the employee doesn't have to feel alone anymore in whatever situation or problem that they are in. It's truly a beautiful thing. We have a whole strategy on how managers and leaders can do that through emotional intelligence. It's completely different training, but we talk about the ability of being able to do that. So that brings me to then how we can build a personal connection by sharing the relatable experience with the employee. We can express our experience that connect with the employee's perspective and emotions. Not everyone has a substance use disorder, right? So the idea is being able to relate with someone who has challenges, and how the idea of doing that was honestly a little hard for me to wrap my head around. But when I continued talking to managers who had supervised employees in recovery, I learned that they relate to them on a human level. And then I realized when I reflected on my own program, how much this happens within my own community as well. For example, I did mention, I'm in recovery. I work a 12-step program, and the sponsor I chose is not, nor ever has been addicted to the same substance that I was. In fact, he never even tried it. But when I called him and I asked for help and told him what was going on, how I was feeling, that was enough for him to remember when he felt the same exact way. And when he shared that with me, I just cried. I didn't know it was possible. I felt instantly connected with someone. As human beings, we all have a story that comprises of our dreams, efforts, successes, failures, emotions, whatever that make up our own personal experience, and looking past the detail of what employees may be going through and identifying with how they're feeling, remembering a time where we felt or saw something the same way and then sharing that with them. That's powerful. So let's take a look at some examples on this screen. So here we have an employee that says, I'm really upset it's taking me this long to get sober. I should know better by now. What do you think this employee is feeling? Anybody just want to unmute?
Maybe hopeless?
Hopeless. It's a good one. Anybody else?
Kendall said regretful.
Regretful. Those are really good ones. Let's see what I have here. I have angry, beating self up, right? Self-doubt. I think hopeless, regretful, those all fall into there. So how many people have ever felt regretful? How many people have ever felt angry or doubted yourself? I know I have.
Jenny said shame too.
Shame. Yeah. So don't you think a manager could have felt those same feelings before? Yeah, possibly. So here we have a manager that says, I remember when I was diagnosed pre-diabetic and still couldn't resist sugar. Now I have to check my blood every freaking day, right? And I could kick myself for not changing my diet. Relatable. Here we have an employee that says, I can't believe I called off work on Monday because I drank too much. What do you think this employee's feeling?
Maybe
start
shame
pla-
again.
Yeah, I'm gonna start playing that Jeopardy song, when you're waiting for the answer. Yeah. Shame, yeah. How about embarrassed as well? Good one, right? I know that we've all felt that on a human level. At a previous job, a few of us managers got together on Super Bowl and we all got drunk and called off work. Don't need a substance use disorder for that either, right? Instant relatability. Here we have an employee that says, I'm doing my best with my new sponsor. This is also new to me and he's kind of hard on me. I hope he sees I'm really trying. What do you think he's feeling? Well, insecure, afraid, vulnerable. All right. I'm sure there's managers who have felt those feelings. How about when I got this position as your manager, the director wasn't sure if I would make it. I didn't think he believed in me, but I did the best I could anyway, and I'm so happy I did. Instant relatability, because I don't need to be considered to have a substance use disorder. I can see the feeling. I can remember where I felt the same thing, and you don't have to feel like that. You're alone in that. Yeah, the detail is different, but guess what? It's going to be different. Even if you're in recovery, there's always going to be a detail that's different. Do I have to focus on that? Not anymore. I know we have 10 minutes left and I want to jump into one more thing. So I'm going to do a role play activity real quick. Okay, for this, I need 2 volunteers. So I'm going to call on Michelle Hepner on the screen to be our first volunteer. Michelle, are you willing?
Sure.
Okay, and then I have Janet Jake Lambert next to you on my screen. Are you willing?
I'm willing. My name is Jake. Thanks.
Jake, got it. Thank you. Thank you, Michelle and Jake. All right, so here we have a scenario. And then what we're going to do is Jake is going to be the manager and Michelle is going to be the employee in recovery. And I'll explain in the next screen. So the scenario is Sophia has worked for the company several years and has had great connection with everyone on the team. Everyone is aware that Sophia is sober and knows her to be on time and never leave without finishing her duties. So when Sophia called off work sick on Monday, there was no suspicion or concern that it was due to substance use. No one knew that Sophia was experiencing conflict with her family, which brought up unresolved trauma from her childhood. And after work on Friday, Sophia went home to drink and used drugs to numb the pain. On Tuesday, Sophia comes to work and sees her manager alone in the office. She wants to tell her manager the truth, but is scared that she may get fired. So, Michelle, if you
Mhm.
would be so kind,
Okay.
right,
Good
to
morning.
be the employee, and then Jake, you'll be the manager. And here's what I want you guys to do: use the script to engage in this conversation, right? Think about the employee, right, is struggling with substance use, and Jake, you're the manager there to listen. And once she's done, right, I want you to think of how you can express some empathy toward toward the employee and how you might be able to share a relatable experience. Okay, whenever you're ready.
Good morning, Jake. I have something difficult to tell you. I know I called off work yesterday, but I wasn't sick. I relapsed. I'm not sure what to do next. I was afraid to say anything to you. I don't want to lose my job, but I need some help.
Okay, Michelle, thank you so much for trusting me enough to tell me this. I'm sure you're having a lot of emotions right now that are difficult, and especially the fear that you have of possibly losing your job. So let me right off the bat say you're not going to lose your job. You're a valuable employee. I know you well. You've always met all of your responsibilities and expectations here. So let's put that fear off the table. I also want you to know that I've experienced a relapse in my recovery as well. And I was afraid to come talk to anybody. And what I had to do was talk to somebody I trusted and get the reassurance that I was okay and I could get back on track. And I'm hoping that you're going to get through this okay and find yourself back on track. I have every confidence in your abilities, as I've known you long enough to see how solid your recovery really is.
Thank you. This is so important to me. I thank you for understanding.
Wow. Good job, guys. That was beautiful. This is what it's about.
It should
You
all go
know,
like that, right?
I wish they could all go like that.
Beautifully done, Jake.
Thank you.
Thank you guys so much. You know, if we got to spread the word that this is possible, that conversations like that are possible, you know, that people can come to us and say, hey, I need help, you know, especially if they're coming to us, you know, that's a willingness that is so hard, and a courage that I can't even imagine. So what to do in that critical moment is going to be so important. Thank you guys for showing us what can be done. So I've gone over the benefits last time. You know, when we have employees in recovery who are feeling like the opportunity for them to continue with their health and well-being is always there, they're going to be a better employee overall. You know, there's statistics, a bunch of statistics that I mentioned last week, and that you see on the screen that just prove that that is the case. I have resources that I sent out last session that Azura, I'll include these slides as well. My contact info is available. And with that, I'll leave the last 5 minutes for any questions, comments, or that you guys have.
Yeah, and feel free to unmute. I can stop the recording too if people feel more comfortable chatting that way. Let's see here.